When you think of implants, it's common to think breast or butt. However, I'm sure you've heard of a chin implant, but I'm going to show you how it's performed today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking about chin augmentation, which is one of the fastest growing plastic surgery requests right here in America, because patients are realising that the chin and jaw, along with other parts of the facial skeleton, have an important impact on the way we're perceived. And here to discuss options with me is Dr. Rose. Thank you for joining us again.
It's good to be here.
Remember what I just said, we are more concerned about the way we are perceived. Why is that?
You know, I think everybody is very self-critical, but then, you know, if you look at the media and, you know, celebrities, etc., people are just becoming more and more beautiful and more conscious about the way they look. And to advance yourself in the workplace frequently, they think of that as well.
Well, can I just say you blame the media? Well, we're blaming you because you're doing the work. And you are responsible for making people more beautiful. And let me say to you, it's what they perceive as more beautiful, isn't it?
Absolutely. Because one person's perception of beauty is completely different than another's, and we as plastic surgeons are trained on what the aesthetic ideals are. But it's always really critical to listen to the patient to see what it is that they don't like about their look, because it may not necessarily be what the aesthetic ideal is.
Interesting. Dr. Rose, is there ever such a terminology as the perfectly shaped face?
That's a hard question to answer, because the honest truth is a perfectly symmetric face was found in one study to be slightly inferior, where they took two halves of the face and transposed it onto the other side, so the right side of their face was also the left side of their face. And they were actually found by onlookers to be less attractive than when they had an asymmetric face. That's comparing left to right, but when it comes from top to bottom, the upper third, middle third, and the lower thirds have to be in the right proportions. And in general, the face should be more of a heart shape.
Okay.
Yeah.
So that's truly what a good face should look like, a heart shape.
I mean, if you think about facial aging, what tends to happen is the tissues start to droop down like this. So you convert a heart shape down to more of like a square type
I
of
got
shape.
you. Let's talk about chin augmentation. I said in my opening that is becoming one of the fastest requested surgeries.
Right.
Why? Has it improved? Is it something we're more conscious of now?
I think it's just something that we're more conscious of, and people are becoming more and more educated, partially because of the internet, I think. But when you look at facial proportions, the people will frequently come in and ask about their nose. They don't like their nose, and the truth is it's their chin. And so that needs to be brought to their attention. They think their nose is big, but it's their chin is recessed. And so if you bring that to their attention and show them, you know, using computer imaging, etc., you can actually show them what they could look like.
It's not the nose after all.
Yeah.
That's an interesting point that you've just brought up. I want to talk about someone who's quite famous, who's had a very pronounced jawline, Jay Leno, okay?
Right.
We're talking in this show today about doing an implant, but you can also have it shaved down. Why would you think someone like Jay Leno would never have done that?
Probably because it's such a powerful masculine feature to have a strong jawline. And I think early on in his career, he already looked like that and started to become successful, so why change it? I think if he would have changed it, it would have been destructive for his career.
He's known for that strong jawline.
Yeah.
Well, let's talk about with women. Would you recommend having it, what is the right terminology? I say shave it down.
Right.
Is that the right terminology?
Well, there's a lot of different things that the oral surgeons can do that I don't do, where they can actually adjust the mandible itself to be, and those are much more involved surgical procedures, whereas putting a little chin implant in that takes, you know, 30 minutes to do is a much simpler procedure.
Okay, what is the recovery time for when you have this type of procedure, a chin implant?
Yeah, a chin implant the recovery is actually quite slick. The problem is that we have patients wear almost like a girdle on the outside to kind of help minimize swelling, and we really want them to wear that to some degree for 6 weeks, but you know,
not everyone's going to walk around with that, my friend.
A couple weeks and they're good. They just have them wear it at night.
Okay, I want you to be honest with me. Is there any type of side effects with this? having this procedure?
So if you put in an implant that's too big, it can make it so that your lips don't come together very well because it's pulling out on your soft tissue so much that you can actually get a little bit of lower incisor show and a lack of the lips coming together in the front.
Interesting. I can only assume it would be more relevant for females to be having a chin implant.
Yeah, but you'd be surprised. There are a lot of men that come in and have it, and I think part of what happens is that they just don't really think about it necessarily, and it's really their nose, or they think that their neck is too fat.
Would you do nose and chin?
Frequently.
Really?
Yeah. Sculpting the neck a little bit with a little bit of lipo, adding a little bit of projection in the chin, and then decreasing the projection of the nose makes a dramatic difference.
I'm looking forward to seeing this procedure today, Dr. Rose. Well, coming up, we'll learn more from our fantastic doctor and a chin augmentation before we meet our patient, Carrie.
My face has always lacked definition, and it's kind of bothered me.
Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyoungeryou.tv and check it out. Love to hear your comments.
I'm here with Dr. Rose and we're talking about our chin augmentation and how it can give you a more balanced appearance. Dr. Rose, in the commercial break you gave me a chin implant. Now this isn't the one we're using today, but it sort of feels a bit weird.
Right, yeah, that one is, it's a textured type of an implant, and so as it goes in, the tissue kind of grows into it, which is kind of nice because it helps minimize the risk of the implant displacing or moving. But if you ever wanted to remove one of those, that is a bugger.
Oh, that's interesting.
So removal of a smooth silicone implant is easy.
I want you to say, they don't break off when they're in your chin. No. I just pulled that apart. I want to ask you, when you say it's hard to remove, what do you mean?
The tissue actually grows into the implant, and that's on purpose, so it minimizes the risk.
I'm playing with this right now as you're trying to give me good information. I would assume there's different sizes for everyone.
Yeah, correct. Usually it's a small, medium, large, but then there's all different types of shapes.
Okay, the texture of this, let me take you back to when we talk about breast augmentation.
Right.
A smooth and a rough texture.
Correct.
What are you saying is the best type of an implant for a chin?
I honestly think that the smooth is better.
Really?
Simply because if you ever had to remove it, it's so easy to remove.
It just slides out.
It's a little softer.
Okay.
And so if you bump up against it, this one will actually just feel like your bone, which is not a bad thing.
Which is giving me the creepies a little bit because I feel like I'm touching bone. I have a viewer question for you. You ready? Mm-hmm. Okay, are you able to get the same effect using fillers rather than an implant? Now, fillers we're talking regarding injectables.
Correct.
Is that possible?
It is absolutely possible.
It's a lot of filler though, wouldn't it be?
You know, one implant probably is only a couple cc's of volume anyway.
Oh.
You know, you can make a significant change with filler alone.
But it looks so much bigger, and that looks like a lot of filler that would need to be injected.
Well, if we had a syringe full of, say, Radiesse, which is also white, the volume would be about half that, probably.
Okay. Interesting question from another viewer. How do you prevent scarring on such a visual area?
Well, you know, if you look at most people when they were a kid, jumping on a bed, they hit their chin, they fall down on the playground, hit their chin. A lot of people have a scar down here anyway. And so we make the incision here just slightly out of what's called the mental crease, because there's actually a normal indentation where your chin meets your neck. But if you come just slightly below that and parallel that crease, it's really hard to see the line.
Thank you so much for bringing this in, even though I personally feel it feels a little creepy. I'm sorry about that. Well, now it's time to meet Carrie and find out why she really wanted to have a chin augmentation. And we're going to see this amazing procedure done with Dr. Rose after this.
My name is Carrie, and I'll be getting a chin implant and liposuction on my jowls and some fat removed from under my chin and from my cheeks. I'm a young mom with 3 kids, and I'm a stay-at-home mom, so kind of chasing them around all day. My husband was a little nervous about it because it's going to change the way that I look. So, you know, I don't know, he was worried about how different I would look, but I've talked him into it and he feels a lot more reassured about it.
We're going to be removing 2 fat pads. So one is right here underneath the chin. It's called the submental fat pad. And then we're going to be removing 2 fat pads that are deep in the central portion of the cheek through here.
I didn't really know this existed, and then I just kind of looked into what I could possibly do, and I found this. Well, I initially went in and just to talk about a chin implant, and he said that would be great, but these other things would really improve your overall look in addition to that.
It's actually really rare for me to recommend doing liposuction on someone's face because in general, we like to think of fat as being youthful in the face. So we're going to be conservative with that, and we're not going to try to make a huge change.
I'm the youngest of 5 sisters, so yeah, a lot of other faces to compare myself to, I guess. I think my sisters have a lot more definition to their faces, and it'll be interesting to see if I end up looking a little bit more like them, because as it stands right now, I really don't look like anybody.
The chin implant is going to go right on top of the mandible out this way. And I selected the small size so we don't do too much of a significant augmentation because we don't want to pull your lip down.
I'm a cosmetologist, and in school we learned about face shapes and all this stuff, and balance is really what you try to achieve with a hairstyle or a haircut or makeup. That's what the goal is. And no matter how much makeup or proper haircuts or things like that, I can't seem to get my face balanced enough to feel comfortable. I feel really confident. I feel like it's going to be great. I am going to be so excited when I see my final result and see what I kind of always wanted to look like. I'm going to be really excited.
After the commercial, let's check back in with Carrie to find out a little bit more why she felt like she wanted to have this procedure. Closed captioning for The Younger You is brought to you by Mindful Medical. The following footage contains surgical procedures. It may be too graphic for some viewers. Like us on Facebook for updates on the show and how to join the Younger You conversation. Now that we've met Carrie, let's finish watching Dr. Rose perform this incredible facial implant procedure.
So today what we've been able to do is help a patient who basically has a genetic predisposition to have very full cheeks and also a recessed chin. What I instructed her is that it would be a good idea actually if she went and saw an oral surgeon so the oral surgeon can fix the underlying skeletal problem.
I looked into actual jaw surgery, but it ended up not really being necessary, and it's pretty extreme.
So, as a plastic surgeon who doesn't do the orthognathic surgery, the only thing that I have to offer is to make this area less full through the submental area and the chin, and then to make the projection of the chin slightly more.
My face has always lacked definition, and it's kind of bothered me for a long time, so getting it kind of fixed is exciting.
A lot of the time the reason why we're doing something in the neck in addition to a chin implant is to try to make more of a dramatic change. Because a lot of times if you just go and you just add volume or projection to the chin, but you don't really kind of clean up the fullness that's underneath the neck, it just doesn't look quite as good.
When you do liposuction, your non-dominant hand is just as important as your dominant hand, and you get a good sense of the depth of the cannula, and you can kind of help control the motion of the skin. It just overall gives you a better result.
You have 2 muscles that run vertically on your neck, and what I did is I basically divided the muscles along the midline so that I could get access to that fat pad. And then I removed the fat pad and then just closed the muscles again. And when I closed them, I overlapped them just slightly. She doesn't really have significant widening of the muscles. Next I'm going to come up onto the face, and this is going to be, again, really conservative. We're not going to get a lot of fat out on purpose. But I'm going to start with coming through the corner right here and just come up onto the cheek. All right, so that looks and feels really good as far as how much I want to do conservatively. So what the liposuction has done already, I can see that it's already created little tunnels that will allow me to dissect through here. Yeah, the implant that goes in is made out of a silastic silicone, and it's a firm silicone that is nothing like a breast implant. And it's intended to be felt almost as if it was bone, but maybe slightly softer. I've chosen a small implant for her, and this is basically made out of silastic. It's silicone. It's a lot hard. It's much more firm than a breast implant. But basically, it's going to sit right here. I went all the way down to the bone itself, and I elevated what's called the periosteum, which is the tough cover on the bone. And so the implant is sitting between the periosteum and the bone, so it's right on the bone. When you put a chin implant in, you basically are holding it in place by making sure that the pocket or the space that you're creating is just barely small enough or big enough to be able to fit that implant, so it's not sliding around. So putting an implant in, because you're putting it in such a small space, it is barely, it's a teeny little vertical slit in periosteum, which is a real tough covering over the bone. It's very difficult to be able to get that implant in through that slit, because you slide it in one way and then you have to bend it and then slide it in the other way, and it's that bend you're trying to stuff it in, essentially. Okay, so we've done the neck lipo, we've removed the fat pad from below, and now what I'm going to do is just repair those muscles and close the skin through here, and then we're going to go intraorally and remove the buccal fat pad. So intraoral meaning in the mouth, we're going to remove the buccal fat pad. The order of this surgery is really important because I was going to be operating externally outside the mouth and also intraorally. And whenever you operate inside the mouth, it's impossible to completely sterilize everything in there because of all the crevices in the teeth, etc. So basically this is the buccal fat pad. And just like I said, it's about the size of a small walnut. Yeah, it takes 3 months to have complete scar maturation. So after a few weeks, there's less likely of a chance, but I still tell them to be super, super careful for at least 2 months. And really, theoretically, it's 3.
I'm expecting to feel a lot more confident with my jawline and my smile and my face in general.
And a lot of times people don't necessarily know that they've had something done. They think they just look refreshed. They look more attractive. Did you lose some weight? Like people will ask them questions, and that's my goal, is to not have people think, oh, look what she did to her face. My approach to patients is, number one, be conservative and do whatever you do to make them a better looking them. They still look like themselves, but they look better.
When we get back, Carrie will be here so we can finally see her transformation. Stick with us. Well, it's transformation time. We need to check out Carrie's before and after shots. Oh my goodness, you don't even look like the same gal.
Yeah.
What do you say when I say something like that to you?
Feels good.
Does it?
Yeah.
Okay, we have seen throughout the show it wasn't just about this chin implant. You did other procedures as well.
Yeah, it's always about facial balance, So when I see a
Because
patient
we touched on
about
that, didn't we?
proportions and stuff, I thought, what she complained a lot about was the fullness in the cheeks, and so there is a fat pad deep in the center of the cheek that we removed from the inside of the mouth. Then we also did some liposuction of the jowls very conservatively, because you don't want to take too much fat out of the face because that can age a person.
Oh,
and
we
then
don't want that, Carrie.
Yeah. And then we sculpted the neck a little bit with some liposuction through here, and then put the implant through the incisional line.
Okay, how do you feel about it?
I feel amazing.
Do you?
I do.
Talk me through why you felt you needed to have this.
Ever since I was, 14, I noticed, why does my face look different than everyone else? Because I just had a very recessed chin and very full cheeks. So I felt self-conscious, and then I had 3 kids, and so my jawline just got fuller and fuller. And
is that normal, or is it just because we've just added a little bit of weight? Because I know when I've put on weight, which is right now, let me tell you, I have a fuller neck.
Right.
And there's nothing I can do about that, apart from diet, exercise, and maybe liposuction. Is it something that she could have looked after without having a chin implant?
It's really the skeletal support underneath the soft tissues is what we had to change.
Oh, I understand.
Yeah.
Did you used to look at other people and say, gosh, I wish I had their jawline or their chin?
Yes.
What's your ideal jawline?
What I have right now.
Perfect answer. I love that. When you went into Dr. Rose to talk about your chin implant, was it possible that you thought there were other procedures that he would be suggesting for you?
I didn't expect it. I thought we would just be talking about a chin, and that's it.
Did you ever think that you could, because obviously you've heard about liposuction, did you think that it was possible to have done on the chin and cheeks?
I didn't, no.
I've never heard of that before.
Sometimes I don't like to suggest to sell stuff because I don't want anyone to think that they're less attractive than they really are. But the problem is that I've noticed throughout my career that sometimes people will say like, oh, how come you didn't tell me about that ahead of time, you know? So if I get a result and they don't necessarily love it, I say, well, we could have done this. And they're like, well, why didn't you tell me that?
Why didn't you do it?
Yeah.
See, that would be me. Now, we're looking at some skincare products that you hadn't used before. Dr. Rose was like, if we're going to do this, let's make sure that we take care of it and do the big wow factor. Had you ever used professional prescribed products before, as in skincare?
No, I haven't.
You've always used things from the supermarket or pharmacy?
Yeah.
Why is it important to be recommended with the right type of skincare, Dr. Rose?
Everybody's skin is so different, and it's almost impossible for people to know what's best for them. So when you have a really well-trained esthetician that can look at your skin and give you recommendations, whether you have oily skin, dry skin, you tend to have pimples, you know, and there's different parts of the face can be different. And so there's all these different things that all need to be looked at when you evaluate a patient for skincare.
Looking at you side on, Carrie, your chin and neck look incredible. I was listening to you, but I was also focused on, I was sort of dreaming a little bit, thinking, maybe I might have a bit more liposuction myself. Incredible. I'm so brave of you to be able to do this for us. We truly appreciate it. I wanted to ask you something before we left. Has anyone noticed?
I don't think anyone really knows what's different, but they know something's different.
Yeah.
So it's subtle enough that no one's like, oh, your chin has grown, you know, nothing like that. But
Chin has grown, I love that. But I can only imagine people would look at you and think, has she lost weight? Has she been on a diet? Has she been exercising? But they don't really know what. And do you think that's the best question you should be asked? Something good about you, but not quite sure.
See, that's the thing. When you see somebody and you can just tell that they've had plastic surgery, that typically is usually bad plastic surgery. So the people that just look refreshed and better them, you don't necessarily know that they've had it.
Yeah.
And that's really what my goal is,
Yeah,
is to
I agree
do
with
something
you.
natural.
When you're walking down the street, say in 3 months' time, and people say, I remember you from the younger you had the chin implant. How did it go? Tell me the good and the bad stuff about it. What is something you would say?
there was pretty much no bad other than being swollen for a couple of weeks. It was a great experience and really easy recovery. So
I like to hear that, Dr. Rose. Thank you so much. We appreciate you sharing the journey, and I'm telling you, my friend, you're looking pretty good, Carrie. Good job. If you look in the mirror and aren't happy with the face that is looking back at you, facial augmentation could be just one of the options that could give you a more balanced and proportioned appearance. But remember, beauty is in the eye of the beholder. For more information about the show or Dr. Rose, please visit our website at theyoungeryou.tv, and I'll see you next week. On next week's episode of The Younger You, it's all about the boys, and Jason, our patient, gets a tummy tuck scar revision. We brought Jason to you because he had an issue from a previous surgery.
The Younger You set provided by Madison McCord Interiors.